Are you in your mid-30s or beyond, contemplating a mommy makeover? The good news is there is no absolute upper age limit for this transformative procedure. The defining factor for eligibility and success is always overall health, not chronological years. However, the process does demand a specialized approach for the 35-plus candidate. The most significant shift is the natural decline in skin elasticity and collagen production. This means procedures like a tummy tuck or breast lift may require a more extensive approach to achieve firm, smooth results than for a younger patient. The highly customized mommy makeover typically combines a tummy tuck, breast rejuvenation, and liposuction. For women over 35, the surgical plan shifts to maximizing lifting and contouring. This is why comprehensive preoperative health evaluations like an ECG and blood work are mandatory to ensure safety and potentially limit the duration of combination surgery. Eligibility hinges on maintaining a stable weight and ideally having a body mass index (BMI) under 30. Nicotine abstinence at least 6 weeks prior and avoiding blood-thinning medications are non-negotiable requirements to minimize complications and tissue loss. While the healing capacity may be slightly slower, most patients return to light activity within 1 to 2 weeks and desk work within 2 to 3 weeks. Full recovery typically takes 4 to 6 weeks. If the signs of pregnancy and aging have left a figure that no longer reflects inner vitality, the next step is a detailed, confidential consultation with one of our experienced plastic surgeons.